in the DMV, that services the DMV area. So it's really good to have you on the show. Very important, a strategic alliance for us. We've had a lot of people from DC on the show. We've had J.R. Myers was on the show. So we have some people from AmeriHealth coming on the show. DC is such an important market. It's whatever goes on in DC plays nationally. So that's where all of your lobbyists are. That's where your policy. And so there's a lot of pressure on a CareFirst as a Blue. And I know the Blue culture. Been in Blue, been at Highmark, been at BlueCross BlueShield of Arizona. Know the Fast Network people. Very, very, very connected and affiliated with the Blue culture. To be in DC, in the heart of it all, you got to run a strong health plan. You know, you guys are, after being out of managed care for many years, have gotten back into managed care the last couple of years, both on the Medicare and Medicaid line of business. I spent a lot of my formative years in the Metro DC area, Columbia, way out, Prince George's, way out going towards Baltimore. But I know what's going on in Baltimore, I know what's going on in DC, know what's going on in between. And there are a lot of challenges in some of those communities. A lot of challenges in Prince George's County, a lot of challenges you get up towards Baltimore, West Baltimore, some of the poorest neighborhoods in the country. A lot of challenges down in Ward 7 and Ward 8 in DC. Shout out to Anita Adams, who is also a frequent contributor to the show, the CEO of Howard Hospital. So we're very deep in this space. So it's just good to have you on the show. I know that you're very passionate about risk adjustment and very passionate about the submission criteria. You and my partner, Kimrick Waldwin, were just talking offline about the process and the importance of submissions and importance of care management, all of that good stuff. Wanted to start, BK, how have you enjoyed the conference? You said it was your first conference. I didn't know it was your first conference.
Yeah, it's my first time at Rise.
So what have you learned?
Well, I learned that, one, as an industry, we're all learning at the same time.
That's true.
And that we're trying to figure out, COVID has really pushed the envelope on how much of a very, fragile infrastructure we have in healthcare. One, because we're not creating win-win systems for providers and for patients.
True.
And because of that, we're understanding the complexities that we need to solve for. But at the end of the day, we have to stabilize that relationship with the provider and the patient and make sure that the way we're building, the things that we're learning are sustainable over time. Because, one, from a compliance standpoint, there's a lot more regulatory eyes on the work that health plans are doing, and the vendors that are supplying some of the technology and some of the information that influence that work. And there's a lot more eyes on, is it truly improving patient care? And so, being able to be in an environment where that's been the constant theme, and a lot of what of the education and information sharing is focused on, has been great. It's helped me kind of formulate my own ideas that I want to take back to CareFirst to improve our structures so that we are developing sustainable solutions for, again, providers and for our members.
Very nice. Tell me a little bit about your education background. Are you from the Maryland Metro DC area?
So I'm a West Coast kid. Grew up. I don't know if you're familiar with the movie Coach Carter, Richmond, California. That's my hometown. Grew up on the West Coast, but then came to East Coast.
Were you literally an Oiler? Did you grow up did you go to that school?
I did not go to that school.
Oh, okay.
My mom made it adamant that I didn't go to Richmond High.
Okay.
But I had an opportunity to, go to school in San Francisco and just kind of commute from my community in Richmond and go to the school in San Francisco and just see the differences in the various communities of the Bay Area. And that's where, my passion, a lot comes from, is seeing, that while we are all trying to, we have one kind of story in the Bay Area, the way we manifest that story is very different.
Okay.
And so, my goal is to, use healthcare as a platform to tell the different member experiences and how healthcare influences how we show up for our lives and for the things that we hope to pursue.
Nice.
And make sure that healthcare adds value to it and doesn't take away value from that.
Very, very, very nice. So tell us about your specific role with CareFirst. What are you really focused on?
So I'm a program manager for the risk adjustment program, but also work in collaboration with our quality and STARS team to ensure that we are complementary in our work, so that the way we present ourselves to our members is beneficial from a both quality and risk adjustment standpoint. Okay.
So are you focused? So tell us a little bit about. Because I'm 2 years removed from being on the health plan side, so I've been in business for myself, I've been a consultant for a while. Are people on that side? Are you focused on prospective work? Are you focused on retro? Are you focused on the EMR pool? Is it value-based care? What are some of the things that you're focused on, someone that's running a risk adjustment team? When I was doing risk adjustment, a lot of it was chart retrieval and coding. But as I was getting more mature in that business, you wanted to get more prospective. You wanted to get more at the point of care. Obviously, I have a grandmother that's 95 that I take care of. I don't want her getting something on the chart next year. If she has an issue, I want to take care of it now. So what are some of the strategies that people are using now?
So right now, one of the reasons, the things that I've been focused on doing is improving our prospective process for both risk adjustment and for quality. Making sure that we are stabilizing and enhancing that provider member interaction.
Okay.
Because that's where ultimately we can get it right the first time.
That's right.
And then whatever we can learn to improve, we want to focus on retrospectively. But we don't want to build a program that's solely based on what's already happened.
Okay.
When that puts us in a position where we're playing catch up versus being able to influence something that can happen now and then be improved for the member and the provider throughout the year.
Okay. Tell us specifically, so how many members are on you're doing Medicare and Medicaid, or are you just on the Medicare? What lines of business do you work on?
So my focus right now is on the Medicare line of business and our DSNP plan.
Okay, DSNP. How many members are on the plan? So for those listening, because this is in many ways an infomercial for CareFirst. So CareFirst is a dominant market player in the DC area. So if you're listening in the DC area and you're looking for a plan or you're about to age into MA, you definitely want to consider CareFirst. How many members are on your plan right now?
So we just started our MA plan last year. And so we have about 5,000 lives and growing.
5,000 lives, all right.
And then on our DSNP plan, we have about close to 8,000 lives and growing. And then we're also moving into the Medicaid space as well.
Right.
And so that would include Maryland Medicaid and DC Medicaid. And so those are all growing government programs that we are looking to enhance and add value to the members who participate in them.
What do you look at? So I'm here with EpiSource, obviously. What do you look at when you're talking to vendors and RFP? I think that this conference, we've really this is your first time at Rise, so you're learning and growing. We're all learning and growing, but it's much more labor intensive from audits than it was when I first got in this business, 13 years ago. The audit process was very simple and rudimentary. Now you have to be prepared for audits 24 hours a day, not just with your submission data, but just in the way that you treat your members. You have the CAP survey, which is so valuable for your star ratings. What do you look at when you're evaluating a vendor and actually looking to do business with a vendor? What are some of the things that you're looking for?
Well, so my priority is one, how agile and how nimble is your data onboarding? Right. Because healthcare data is messy, right? And so both on the payer side and then also the requirements that each vendor needs. And so, with healthcare and health plans, we have very limited data and IT resources. Yeah. So if it requires us a significant lift for development to meet your needs, then that's going to impact our implementation. That's going to impact our ability to provide services to our members. And so do you have a very nimble, flexible, and agile data platform that where we can share our data, you can work with it and still provide the services that we're looking for you to develop. Okay. And then integration. How are you able to, what's the feedback loop? How are you able to give us back the information that we need to make informed data decisions on the services that we provide? And does that feedback loop provide and improve or enhance continuity of care? And so, are we able to get information back to the providers that's actionable, useful, and they can trust? Because we know that doctor and physician trust is very fragile when it comes to health plan sharing them data. And so, any vendor that can meet kind of those top three requirements, gives us opportunity to really take a look at you and even and pursue further a potential relationship to work with us and our different products.
So tell us about. Are you in D.C., Maryland, and Northern Virginia, or just D.C. and Maryland? What are the states that you actually cover, the counties that you actually cover?
Our commercial plan covers pretty much the whole Mid-Atlantic.
Okay, that's what I thought.
And then our Medicare Advantage plan has a very strong presence in the Maryland communities.
Okay.
As well as a little bit in Virginia.
Okay.
And then our Medicaid is right now primarily DC, Maryland and D.C.
What are some of the challenges that you see? I mean, you're looking at it from a leadership perspective, but we were just talking about individuals that have chronic illness that they really need to go into care management programs. You got to document properly, and you got to make sure that there's the constant feedback loop that they're finding out that they need to go into care management not 6 months after the fact when there's more damage that's done to the body. What are some of the challenges that you see in your region of the country that may mitigate the ability of someone such as yourself and and Sabu people that have macro level leadership plans? What are some of the challenges in the DMV?
So it goes back to having good data, right? Having good data is one of the biggest challenges, because if you have optimal data, you're able to stratify more accurately. And I think being able to stratify our population, in a way that allows us to truly understand our various subgroups, and then figuring out how do we treat each subgroup appropriately to make sure that we're maximizing their needs and we're providing them the proper services.